Neurons over nephrons. This topic was slightly introduced in the discussion yesterday. So many were asking about this particular issue of neurons over nephrons. This is one of the commonest problem encountered by neurologists and stroke specialists all over the world. We do a CT scan and decide on thrombolysis, and when we request for a CT angiogram, invariably the radiographer or the radiology department will ask for a serum creatinine level, and there have been many instances where they refuse to do a CT angiogram without a serum creatinine value. So let us see what the evidence regarding this particular issue and what can be done in such situations. I am Dr. Jiji Kurutukulam, interventional stroke neurologist, and along with me is Dr. Jidin, who is doing his fellowship in stroke interventions. So, which is more important, the neurons or the nephrons? So, I would like to bring your attention to a particular article which was published in 2017 in Stroke Journal, the reputed Stroke Journal, and the title of that particular article was Neurons over Nephrons. This was a systematic meta-analysis, review and meta-analysis of contrast-induced nephropathy in patients with acute stroke. So one of the leading author was Andrew Dumchuk, you all know him. So this is a reputed article done by reputed people. And what is the purpose of doing this study? Because the perceived risk of contrast-induced acute kidney injury, many centers require pre-imaging serum creatinine levels, potentially delaying care. And this study looked into, this was a systematic review and meta-analysis evaluating what are the acute kidney injury rates in patients with acute ischemic stroke receiving who are subjected to CT angiography or CT perfusion study. So, Jidin, would you like to elaborate more on this? This was mainly they looked into all the studies available in this, and they streamlined or isolated 8 single-arm studies and 6 case control studies. So, what is the risk of, why are we too much bothered about this acute kidney injury?
Because in CT angiogram we are giving contrast usually around 100 to 140 ml of contrast, which can result in an acute kidney injury, that is 25% increase in baseline serum creatinine level.
So what is the definition of acute kidney injury?
It's more than 25% increase in serum creatinine.
So somebody is having 1 creatinine level, if it goes to
1.25
or more, then that means there is an acute kidney injury. So it has been shown that a renal dysfunction or acute kidney injury can be a risk factor for poor outcome after acute ischemic stroke. So that is why many times we are bothered about this particular issue. So how was this particular study done?
So they have compared actually 2 things. One is
what they did was more than 6,000 patients who underwent CT angiogram and CT perfusion study in the setting of an acute ischemic stroke. And they looked into what happened to these patients after receiving the iodinated contrast. So they found that the incidence of acute kidney injury, that means a 25% increase in the serum creatinine level, was almost to the tune of only 3%. That means if you do 100 people, 3 people will have a 25% or marginal increase in serum creatinine level. But what has been interestingly found that hemodialysis rate, that means patients who need hemodialysis because of this, is exceedingly low to the tune of 0.07%. What is 0.07%?
7 in 10,000.
7 in 10,000. That means if you do 10,000 cases, 7 people might require hemodialysis. So when adjusting for baseline creatinine, patients in the CTA group had similar odds of developing acute kidney injury when compared with patients receiving non-contrast CT alone. That means when you compare those groups with undergoing non-contrast CT with CT, the chance of the odds of developing acute kidney injury is both the same. Interestingly, in our meta-analysis, with or without CKD, even with CKD, there was no statistical difference in the the acute kidney injury rate. These findings are important as they suggest that withholding or delaying acute stroke vascular or perfusion imaging because of serum creatinine values may be unnecessary. So, thus, physicians managing patients with stroke in the acute setting should not be feeling that they are facing a dilemma between losing neurons over nephrons, when ordering CTA, because these contrast scans do not have a major deleterious effect on renal function. Now, what is the second issue?
You take the patient for CT angiogram, you find that LVO, and you take the patient for mechanical thrombectomy, which uses more contrast.
So, first you have subjected the patient for a CT angiogram. Then, suppose if they are taking the patient for mechanical thrombectomy, you might be giving more contrast to the same patient. So, will it increase the rate of AKA? That also has been looked into. There was two recently published studies. In the first study, 99 patients who underwent mechanical thrombectomy, they found that the AKA rate just 3%. And in another study of 194 patients, it was just 1.5%. That means the rate of AKA in these studies are similar to the overall rate of 2.4% seen in our meta-analysis. So it is less than 3% in both the groups. So even if you are doing mechanical thrombectomy after CT angiogram, in which both you are using attenuated contrast, still the chance of developing a significant acute kidney injury or needing hemodialysis is very, very rare. So suppose if what are the and the conclusions are, this systematic review and meta-analysis, which includes more than 6,000 patients, found no association between contrast administration for CT angiography or CT perfusion and development of acute kidney injury in patients in the setting of acute ischemic stroke. These findings suggest that delays in imaging and care because of absent or elevated creatinine values are not acceptable. So, whenever you are faced with this problem, you can always quote this article, you can give this article to the radiology department and make it clear beforehand itself that serum creatinine is not mandatory to do CT angiogram. Concerns about AKI should not deter physicians from pursuing their optimal imaging strategy for the management of patients with acute ischemic stroke. So how will it change your clinical practice from now on? Number one should be to talk to the radiology department beforehand itself, show this article, convince both the radiographer as well as the radiology department that serum creatinine is not required. You put a banner saying that serum creatinine is not required for patients with acute ischemic stroke who need CT angiography, because many patients come in the night. So suddenly there will be a confusion that should we do serum creatinine or not. So make it clear beforehand itself. It should not be when the patient is referred for CT angiogram. Second, suppose if the patient says that his creatinine value is 4 or he is already undergoing hemodialysis, would you defer or continue?
Still we can.
If you feel that there is a chance of a large vessel occlusion, definitely you can continue. Why? Because kidney is one organ which has got a regenerating capacity. Neurons doesn't regenerate. So even if there is an acute kidney injury after that, it will recover. Even if it doesn't recover, you can do a hemodialysis and tide over that. Whereas neurons, once it is lost forever. Then what are the precautions you can take to avoid acute kidney injury?
You can use low osmolar contrast agents like VC-Pack. Suppose if the creatinine is high, you know that the patient already has got a elevated creatinine, you can use low osmolar
contrast like VC-Pack. So make it clear that VC-Pack is marginally more expensive, but it will be worth it to use VC-Pack. Second
is you can use N-acetylcysteine injections
or tablets
beforehand
and after the procedure.
CT.
Third, hydrate the patient. Hydrate the patient properly, so that adequate hydration prevents acute kidney injury. So this is something, and you don't have to worry about the serum creatinine level, both for mechanical thrombectomy as well as for CT angiogram. Those who are interested to know more about, this is freely downloadable from the net. It is available you can just search for Neurons over Nephrons. Thank you. Please do share your comments, what you think about this topic discussion. If you have any more points to add to this discussion, please do let us know. Thank you. See you next time with another episode of Stroke Rounds.